Okay. Hopefully the volume works okay. It has been, gosh, probably a year or so since I've done a Facebook Live. I forgot about all the things that you have to click on before you can actually start. So, I'm just going to go ahead and start talking. It's not going to be very long, maybe 5-ish minutes or so, unless I have any other specific questions. So, all right, we'll get this party started. So, for those of you that don't know me, my name is Jen, and I am the physical therapist here at Mid-Missouri Pelvic Health. And we just opened, oh gosh, well, today is 3 months, which is crazy to me. But um, so yeah, we're just right here in Sedalia and trying to come up with, just some ideas to help with awareness of what pelvic floor physical therapy is and really just try to help educate the community on all things pelvic floor. So I thought, we could start like a series of different live videos that I can do. And if people want to jump on and ask questions, they can. Great. If they just want to watch the video later, then that's fine too. So the post that I did yesterday is on bladder norms and all of that stuff. So that's what I'm going to talk about a little bit today. So a lot of times we think that just because something is common, that makes it normal, and that's not necessarily the case. Just we have learned over time that patients just tend to think that if everybody deals with it, it just must be normal, and that's not necessarily the case, especially with different bladder things. So some different things that are common but not normal are just the bladder frequency, right? So if you are peeing more than 7 to 8 times per day, that is considered not normal. Now, there are different things that can feed into that, whether you're just drinking a bunch of water, if you are drinking a lot of things with caffeine in it, that's obviously going to increase your bladder frequency. If you're not emptying your bladder all the way and it's only going from full to half full, back to full and half full quicker, you'll have to pee more often. So those are some things that can influence how often you go to the bathroom. If you are peeing less than 8 Mississippis, that is again considered not normal. So when you have a bathroom break, you really shouldn't pee for 3 seconds and then be done. It should take at least 8 seconds. That kind of indicates that your bladder was at an adequate amount to be full and go ahead and go to the bathroom. So again, if you routinely are peeing less than 8 seconds, then there are some reasons for that, and that's definitely something that can be worked on. If you are leaking urine, ever, like actually it is not normal to pee your pants just because you've had kids. So there are different types of incontinence and they have different names depending on when that leakage happens, but those are all things that can be worked on. So leaking with sneezing, coughing, jumping, laughing, those are all considered stress urinary incontinence. If you have any leakage with like getting to the restroom, or when you get a really strong sense of urgency, like when you pull into the driveway at night, when you're washing your hands, those are called urge incontinence. You can have both, which is then considered mixed incontinence. You can have what's called functional incontinence, where you just physically can't get to the restroom quick enough. You can have overflow incontinence, which is when the bladder itself is literally just overflowing. And they all have different reasons why they occur, and so their treatment is different. So Kegels may or may not help with stress incontinence, but they won't really do a whole lot to treat urge incontinence. So just know that leaking in general is never considered normal, and that is something that I work on with patients all the time. The last one that's on the list is getting up to pee at night. So there are some caveats to this. Now, obviously, when you're pregnant or newly postpartum, kind of everything goes out the window. So getting up to pee at night when you're pregnant or with little kiddos is very different. But if you have not gone through menopause and you're not pregnant or postpartum, you really should not have to get up to go to the bathroom in the middle of the night. You should be able to make it all night long. Now, there are some things that influence that. So if you're not getting into a deep enough of a sleep cycle, your brain's not going to release the hormone that actually slows your urine production down like it's supposed to at night. So you will continue to create pee at the same rate that you would during the day, which is why your bladder might fill if you're not getting that deep sleep, or just drinking way too much stuff right before bed. So typically I tell patients to kind of cut off about 2 hours before, and then you should be able to make it all night long. Obviously, individual advice works a lot better than just watching a video on Facebook, but I at least wanted to kind of go over just a couple of these things that I frequently hear people think are just super, super normal and something that everybody has to deal with. So just know that that's not necessarily the case. If you are experiencing any of those things on that list, such as peeing more than 8 times a day, peeing less than 8 seconds, leaking urine, or getting up to go to the bathroom in the middle of the night, or just having strong urgency really at any time that's impacting your life, those are all things that we can work on in pelvic floor physical therapy. So hopefully you learned something. Like I said, I'm going to keep it short and sweet. And if you have any questions, shoot me a message. You don't necessarily have to comment on the video if you don't want to. You can just shoot me a message, and I'd be happy to chat with you about it. All right. Have a great day, guys.